I hope everyone's having a wonderful day. Today I would like to talk about fixing your testosterone. So this video is mainly for men, but also for women. So testosterone is a hormone that's produced by the gonads, so ovaries in women, testicles in men, but also then produced by the adrenal gland when women go through menopause and men start to go through andropause at around 50 or so. So symptoms of testosterone deficiency oftentimes can look like low libido, erectile dysfunction, or orgasm dysfunction in women, hard time making decisions, hard time maintaining muscle mass or building muscle, problems with stamina. You can have higher cholesterol levels, higher blood sugar levels, and depression and anxiety are very common. So if you think about the grumpier old men in those videos, Walter Matthau and Jack Lemmon, those men had low testosterone, so they were grumpy for sure. And that's, depression, anxiety, and a lot of times that's because their testosterone is low. So those are some of the symptoms of testosterone, and you can have those in both men and women. And then the way that you test for testosterone can be, we're looking for mainly the free bioavailable fractions, but we'll test for total testosterone and free testosterone in blood, and those are good markers. But saliva testing and urine testing are also both very good. If you remember, saliva testing works well unless they are already on bioidentical hormones, and at that point, the urine test really is the best test, though I will also use the free testosterone, which is a good test. The other marker is sex hormone binding globulin, which will bind to free testosterone that is floating around. When this level is high, it indicates that testosterone is low. So that's just another marker and works in a similar way to iron and what's called iron binding capacity. So that's another marker that when it's high, it's indicating that the iron is low because they grip on tighter, and so their levels increase. So that's testing, and then let's. I was going to go into treatment, but let's talk a little bit about the cause. So besides menopause and andropause that can happen around 50 for men and women, there's also a number of things that can disrupt the regulation from the brain and their relationship to the gonads and all of the other hormones in the body. So the first thing is remembering that there's a beautiful dance between the hormones. So the adrenals and the thyroid have to be regulated before you're going after the gonads, before you're going to be boosting up your testosterone. So that's number one. Number two is anything that can mess with this brain's relationship to the gonads needs to be removed. So that's what I call the usual suspects. That's heavy metals, chemicals, molds, which is quite common, especially in younger men. When they come in and they've got low testosterone, oftentimes they've got molds. So heavy metals, chemicals, molds, infections, allergies, emotions, and electromagnetic frequencies. So all of those things can disrupt this relationship between the brain and the gonads and consequently cause a decrease in testosterone. So we'll fix those, and that's a big component of treatment is finding the cause and removing it. And then I'll use that Revolution Pro product by NHI, which you can find in our online store. That is a maca product that is really good at boosting up testosterone naturally. If it doesn't work in a couple months, it's not going to work, and then you want to move on to bioidentical hormone replacement. And for women, oftentimes that's 0.5 milligram up to 2 milligrams, and for men, that looks like starting off usually around 75 milligrams and working my way up to 300 milligrams sometimes, depending on the person. But if I have to get up that high, there's usually something else going on. The usual suspects are at play, and they have to be addressed. Now, some of the risks of testosterone, I always like to give the minimal amount necessary because we always want to allow the body to do what it needs to do and only give a certain amount, only give the smallest amount necessary. It's the safest way to do it. And then ramp up slowly. And so you do want to make sure that you're watching for any signs of blood clots, because you can have an increased risk in blood clotting when you're taking testosterone. So oftentimes I'll have people take nattokinase or serrapeptase, high-dose fish oil, so a number of these things which will keep the blood thin, and most of the time they need it anyway for another reason. So that's some of the risk factors of the testosterone. Now, it's interesting that it has those risk factors because testosterone will also decrease the risk of heart attack, heart disease, stroke, and Alzheimer's. So there's definitely a balance in there that occurs, and everybody's an individual, so those questions have to be answered by your provider. So that's testosterone treatment. I hope you guys enjoyed it. If you found this interesting, please give it a thumbs up. Hey Barbara, thanks for watching. And I hope that, yes, give it a thumbs up, share it with somebody who you think might be helped by this, and check out my book on Amazon. Have a wonderful day.